tired of hearing me say that health systems and health security are two sides of the same coin. But I will keep saying it because it's a fundamental truth. I will keep saying it until vulnerable people are no longer left exposed to outbreaks by the weaknesses of their health systems.
Good morning, good afternoon, and good evening, colleagues. My name is Susanna Jakob, and I am the Deputy Director General of the World Health Organization, and I am delighted to welcome you all here today to launch the WHO position paper, Building Health System Resilience for Universal Health Coverage and Health Security during the COVID-19 pandemic and beyond. With more than 4.5 million deaths globally and unprecedented disruptions to the delivery of essential health services, COVID-19 has and will continue to have a profound effect on the very fabric of our global community. The lessons learned from our experiences are stark and clear. Traditional efforts to strengthen health systems as the means of achieving UHC have not given adequate attention to the essential public health functions, including implementation of IHR. We all must recognize that investing in these population-based functions is not something separate, but rather an integral part of the health system strengthening. This integrated approach is also essential for investments in disease and life course specific programs, which, as we have seen in the polio program's immense contribution to COVID-19 response, can be harnessed for wider health system strengthening against ongoing and emerging public health threats. It is also clear that the health and economic burden of COVID and other public health emergencies has been disproportionately borne by the most vulnerable in our communities, including refugees, internally displaced persons, the homeless, elderly, and those dependent on the informal sector, as well as those living in fragility, in conflict and violence-affected settings. The interdependence between the UHC and health security agendas is a well-acknowledged fact. However, recognizing this is not enough. We must actively integrate our efforts, our support, and our resources to achieve the kind of long-term strengthening required to tackle the health challenges of the 21st century. This position paper leverages what has been learned to guide recovery and transformation efforts so that we build back stronger, fairer health systems based on primary health care to progress towards UHC and achieve health security. This requires investing in health system foundations and the essential public health functions, including an all-hazards approach to emergency risk management and the promotion of whole of government, whole of society engagement. I would like to congratulate all contributors, as well as highlight the collaborative approach which brought together perspectives and expertise from across WHO to inform this important work. I would now like to hand over to my colleague, Dr. Mike Ryan, the Executive Director for Emergency Preparedness and Response in WHO. Over to you, Mike.
Well, thank you, Susanna, and welcome, Your Excellencies, Ministers, our WHO Regional Directors, partners and colleagues. I will be very brief because I think Susanna has laid out the issues very well. I don't think we have to be reminded that COVID-19 has underscored the immense impact that health emergencies can have on our lives, our livelihoods, our very existence. But we've seen those examples before with SARS, multiple Ebola outbreaks in Central and West Africa, the Zika virus, and many other diseases over the last 30 years. We have not learned the lessons for success when it comes to preparing for or responding to these events. Our ability to detect events, characterize those events, and even develop countermeasures has greatly improved, and the timelines for our capacities to develop and deliver those countermeasures is much, much better. But the central pillar of health protection and life-saving in any community is the health system. The ability of the health system both to protect and prevent disease. Most of the mortality in this pandemic was not caused by a virus. It was caused by underlying conditions that have been unmanaged for many decades: hypertension, diabetes, lack of primary health care. It was caused by many older persons being in long-term care facilities with poor infection control measures in place. So our health system is very important for making sure that our population is healthy and in itself individually resilient. Each and every individual in their lives can go through many infectious disease exposures and infections. Their basic state of health is a major determinant for their outcome in that disease. Secondly, the health system is there to save lives when lives need to be saved, and an epidemic is a true stress test of the system. And I've often said that if you really want to see how a system works, you need to put it under stress. And health systems that we've designed and delivered have not dealt with stress very well. They're not designed to deal with stress. They're designed to deliver at 100% capacity all of the time. They're seen as cost centres within our budgeting cycle. Health is seen as a cost, not an investment, and health systems are seen as cost, not investment. We need to turn that around, and we need to see that the health system is not only there for long-term protection of health, but is a dam, it is a bulwark against the impacts of epidemic diseases, and it is the best weapon that we have to fight these infectious diseases when they come along. But it does require that health systems design must take that into account. Building health systems bigger or putting more money into health systems does not make them more resilient. Resilience is a design factor. You design resilience, flexibility, adaptability, agility, and scalability. These are things you design into your system. In the same way we design our aircraft, we design other things. And I think that's where we have to look, and that's why I'm so much looking forward, as we always have, working with our health systems colleagues to see how best we can ensure that universal health coverage can be delivered through strong health systems, but strong and resilient health systems that can continue to do all the work they've done. And when we look at this COVID-19 pandemic and all the suffering, we have to have a major shout out to those health workers working within those health systems around the world, many of whom go for months without pay, many of whom don't have clear career paths. So the health system to me is not the buildings and it's not the bricks and mortar. For me, the health system is its workforce. And when we do look to the future resilience of our health system, Susanna, I know that you're very committed to looking at the resilience and well-being of our health workforce as the major pillar of our collective resilience. So we really look forward to continuing to work with everyone internally and externally on this issue. Many thanks.
Thank you very much, Mike, and thank you to you and to your team to work so closely with the health system team, hand in hand, to make this happen and to come to this stage. And we are also looking forward to move together to the implementation phase with you. This gives me the pleasure and the honor to invite Dr. Tedros Adhanom Ghebreyesus, Director General of WHO, to make his keynote speech. Over to you, Dr. Tedros.
Thank you, Susanna, and thank you also, Mike, for the interventions. I mean, the great ideas you have already said. This is a very important area, and I'm glad that we're all here to push this agenda forward, and of course our regional directors and all staff. Honorable ministers, regional directors, excellencies, dear colleagues and friends, the COVID-19 pandemic has destabilized societies, economies, and governments. It has been a powerful demonstration that when health is at risk, everything is at risk, and that there is no global security without local health security. That's why the task of supporting countries to enhance preparedness and progress toward this universal health coverage based on a foundation of primary health care is more urgent than ever. We have often said that universal health coverage and health security are two sides of the same coin. Resilient health systems built on robust primary health care are a vital first line of defense against outbreaks with epidemic and pandemic potential. But they're also essential for promoting health, preventing communicable and non-communicable diseases, and for reducing inequalities and inequities. In practice, this means a resilient health system that has earned the trust of the communities it serves, is well prepared, well resourced, and flexible enough to absorb the impact of disruptive events and maintain safe health services. And of course, it means a well-paid, well-trained, and well-supplied health workforce. The position paper we're launching today articulates WHO's vision for the recovery of health systems as central to socio-economic recovery and development. This vision is informed by the lessons learned from COVID-19 and recognizes the need for improving equity across the social and environmental determinants of health. The pandemic has magnified the divisions in societies, with the impacts borne disproportionately by the most vulnerable. It comes at a time when we can no longer fail to acknowledge the direct link between the health of populations, the environment, and economic and social systems. Fragmented approach to the way countries finance, plan, implement, and monitor health have perpetuated critical gaps that leaves health systems and populations vulnerable in the face of crises like COVID-19. WHO's vision is to enable integrated approach to improving health systems resilience for universal health coverage and health security based on a foundation of primary health care, with effective community engagement and a greater focus on equity. These are essential to address the prevailing inequities and disproportionate impact of public health emergencies like COVID-19 on marginalized and vulnerable populations, including those in fragile, conflict-affected, and violent contexts. The position paper outlines 7 policy recommendations. First, leverage the current response to COVID-19 to strengthen both pandemic preparedness and health systems. Second, invest in essential public health functions, including those needed for all hazardous emergency risk management. Third, build a strong primary health care foundation for resilient health systems for UHC, the health-related SDGs, and health security. Fourth, invest in institutionalized mechanisms for whole of society engagement. Fifth, promote enabling environments for research, innovation, and learning. Sixth, increase domestic and global investment in health system foundations and all hazardous emergency risk management. And seventh, address pre-existing inequities and the disproportionate impact of COVID-19 on marginalized and vulnerable populations. The position paper spells out each of these policy recommendations in more detail, with actions for each. My thanks and congratulations to all our colleagues who have worked on this position paper. My hope is that all member states read it, implement it, and reap its benefits. Every crisis is an opportunity. Although the pandemic has taken so much from us, it's also giving us the opportunity to write a new future that's healthier, safer, and fairer. Because above all, the pandemic has taught us that health is not a cost to be contained, but an investment to be nurtured. It's not a luxury, but the foundation of social, economic, and political stability. I thank you. Susanna, back to you.
Thank you very much, Dr. Tedros. Universal health coverage and health system strengthening has always been at the heart of your transformation agenda.